individuals report on potential opportunities and challenges impacting data sharing. I'm going to go ahead and turn it over to the county team for a presentation.
Good afternoon, Chairwoman Vargas and members of the board. Last May, your board unanimously approved an action supporting care coordination for the justice-involved individuals through funding and integrated data infrastructure. That action built upon past alternatives to incarceration actions. It was a crucial acknowledgement of the need for a county data governance structure specific for care coordination of justice-involved individuals. Am I echoing? I'm known to be 3D, but that's okay. Thank you. We know that many of justice-involved individuals face adverse health and socioeconomic outcomes, such as chronic diseases and homelessness, at a much greater rate than the general pop. That is why the Health and Human Service Agency is proud to partner on this joint effort with the Public Safety Group and the San Diego County Sheriff's Department and the Office of Evaluation, Performance, and Analytics. Today, we are excited to share the challenges and opportunities identified in our assessment of the existing data infrastructure. With me, our Assistant Sheriff, Teresa Adams-Hatter, our Public Health Medical Officer at Medical Care Services, who oversees the agency's justice-involved health efforts, Dr. Sayon Pavan, and Acting Director of Prevention, Diversion, and Reentry for the Public Safety Group, Sarah Gordon. With that, I'd like to introduce Assistant Sheriff Adams-Hatter, who's been an essential partner in these efforts.
Thank you, Nick. Good morning, Chairwoman Vargas and members of the board. Exchanging data is a critical step to enhance care coordination and monitor program impact for justice-involved individuals as they transition between correctional facilities and the community. Using a person-centered approach is our priority. To illustrate the challenges we identified, we will walk through what could be a very realistic story of a woman we call Anna. 2 years ago, Anna's partner introduced her to meth. Over time, she became addicted. She attended substance abuse disorder counseling through a local community program. After nearly a year of battling her addiction, she lost her job, which also meant losing her health insurance. Because of this, Anna was no longer under care for her high blood pressure and bipolar disorder and stopped taking her medications. Shortly after this, Anna lost her apartment and began sleeping in her car or occasionally on a friend's couch. One day, Anna was arrested for theft in order to make ends meet. She was arrested and booked to Las Colinas Women's Detention and Reentry Facility. Anna was sentenced to 6 months in custody, where she participated in the sheriff's substance abuse program with her correctional counselor. She was also prescribed medications for her high blood pressure and bipolar disorder by a sheriff's medical health provider. As her release date neared, Anna was referred by the sheriff's reentry staff to HHSA's Community Care Coordination Program, also referred to as C3. The C3 team will meet with Anna in jail to complete the intake assessment and sign multiple consent forms as required by state and federal regulation. They've lined up temporary housing and will help her transition back into the community. At this time, I'll turn it over to Dr. Sayon Pavan to continue Anna's journey transitioning back into the community. Dr. Sayon Pavan.
Thank you, Assistant Sheriff Adams-Hatter. The C3 team picks up Anna from jail, takes her to fill a 10-day prescription, and buys her groceries and clothes. Anna will likely run out of her medications before she can see a doctor, and she does not have health insurance and needs to apply for Medi-Cal. Prior to her participation in the C3 program, Anna had never been asked if her information could be shared or added to the region's Health Information Exchange or 211's Community Information Exchange. This means there are no historical records on providers Anna has seen. Eventually, C3 finds healthcare providers who accept Medi-Cal and takes new clients. When Anna visits the doctor for her high blood pressure, they do not have any medical history. She consented to share information around her substance use disorder program she recently started, but regulatory and infrastructure limitation results in information being shared by fax. So instead, Anna answers questions about her past, recounting painful experiences, which is difficult and re-traumatizing. Anna is in temporary housing, but needs a permanent solution. Searching for permanent housing requires entering information into the region's homeless management information system to search for availability, as well as conducting searches through numerous phone calls and emails with housing providers. This resource-intensive process is also impacted by regulations and infrastructure, which limits sharing of information between systems. To summarize, Anna's experience highlights several challenges to sharing timely information between healthcare providers, social service providers, and justice partners that negatively impact her ability to receive seamless care. Enhancing care coordination will better set up Anna for success. At this time, I'd like to turn it over to Sarah Gordon to highlight opportunities to address these challenges.
Thank you, Dr. Theolella-Pavan. There are opportunities to address data sharing and care coordination through addressing regulation, policy and procedure, funding, and infrastructure. I'll highlight opportunities we've identified from each area. With respect to regulation, your board's 2023 legislative agenda lists data infrastructure as a priority area. This presents one mechanism to address regulations that impact sharing criminal justice, health, social services data. The Public Safety Group, Sheriff's Department, Office of Evaluation, Performance and Analytic, and County Council recently met with the state's Department of Justice, who outlined potential steps to sharing criminal justice data while complying with strict regulations. The Department of Justice has offered to meet and provide further guidance to San Diego County in any applications that may be required related to data sharing proposals. Additionally, California Assembly Bill 133 enacted California Advancing and Innovating Medi-Cal, or CalAIM, into law. It requires counties to have a Medi-Cal enrollment process in jails. And the full reentry and justice component of CalAIM was recently authorized, making California the first state to allow individuals in custody to receive certain Medi-Cal benefits and services up to 90 days prior to release. An estimated 80% of individuals in jail qualify for Medi-Cal and will benefit from having access to coverage. Related to policy and procedure, the same legislation, AB 133, also opened formal discussions around a state data exchange framework and a single Medi-Cal consent form. Additionally, the county has identified potential ways to more easily engage with and compensate individuals with prior justice involvement to consult on county projects and initiatives, including data sharing for care coordination. In the area of funding, the May 10th board action gave us the authority to apply for funding related to CalAIM. We've received $250,000 in the first round of CalAIM justice-involved funding to plan for the jail Medi-Cal enrollment process. We will apply for a second round of funding at the end of March to support infrastructure changes needed for that process. And there will be future rounds of funding to help with the pre-release benefits mentioned earlier. We will come back in May to propose a data governance structure to your board, which is a first step to address infrastructure challenges impacting data sharing. At this time, I'll turn it back to Dr. Seyon Theolella-Pavan to discuss our ongoing county and community engagement efforts.
Thank you, Sarah. To develop our governance proposal that we will return with in May, we'll engage with the same county and community groups that we have leveraged for this assessment thus far. As we do so, we are continuing to use the sequential intercept model to guide our analysis with the Alternatives to Incarceration project, which you just heard about in the previous board item. This model has also guided data integration discussions with stakeholders, as we review opportunities for enhancing care coordination and data sharing. While we will return with our proposal in May, we have already made progress in linking existing data sharing and integration efforts across the county, such as the ones you see in front of you. A data sharing and collaboration platform has been enabled to enhance re-entry planning on mutual clients between the Sheriff's Department, the public defenders, and the probation department. Behavioral Health Services is beginning a mobile crisis response team evaluation by establishing data sharing agreements with law enforcement agencies. HHSA and the Sheriff's Department are working towards interoperability between our electronic health records. And the Sheriff's Department is working with 211's Community Information Exchange to securely share jail release date information for care coordination purposes. At this time, I'll turn it back to Nick to speak to the recommendation.
Improvements in the justice-involved data integration will ultimately increase efficiencies in care coordination, program planning, and evaluation. This will not only streamline efforts for our staff and community-based organizations, but most importantly, will ensure supports are in place to ensure Anna's success and the health and well-being of many other people involved with the justice system like her. Data integration will further allow data-driven decision-making with an equity lens, so we know the services are reaching the right individuals and populations and communities with the greatest need. This means that we'll be able to invest in what works, creating pathways for justice-involved individuals to be able to access appropriate care and services. All of these efforts are a result of partnerships, both from within and outside of county government. I want to especially thank the community members who participated in the many forums to discuss this topic, as well as our public safety partners, especially County Sheriff Kelly Martinez, for her great support and leadership in this effort. This is an unprecedented partnership between the Health and Human Service Agency and the Sheriff's Department, and we look forward to continuing to work as a county team of one. Today's action requests your board receive this status report on the challenges and opportunities impacting data sharing, and we appreciate your board's support in this regard. Subject to your questions, that concludes our presentation.
Thank you. We're going to go ahead and go for public comment.
Thank you, Chairwoman Vargas. We have 6 requests to speak on this item. 4 in person and 2 requesting to speak by phone. Also note for the record that we received 1 e-comment. That was a neutral e-comment. For any members of the public that requested to speak on item 20 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, starting with those in favor, followed by those in opposition of this item. As your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. I'd like to invite forward Consuelo, followed by Tom Packard. If I've called your name, please come forward. And those will be followed by Audra and Mark. Again, you'll have 2 minutes to address the board, and I'll ask you to please state your name for the audio record.
Consuelo, and I am speaking in opposition because historically the most terrible things, war, genocide, and slavery, have resulted not from disobedience, but from obedience. People have come to love their oppression. They adore the technologies that undo their capacities to think. Some words regarding authority for the state of slaves. There is no authority on earth that can rightfully govern your life. Born to this world, you and you alone control your eyes, ears, tongue, your hands, your mind. All authority which claims to be able to dispose of you and your abilities is deceit. You were born to this world so that you might have the free agency of life. Life is liberty. With liberty and trust in this world, you can learn and do anything. Anyone who tells you that you must yield your mind, your body, your positions to authority is evil, wrong, bad, wicked. Understand that choices made of your own free will are not evil. There is nothing wrong with sacrifice if it is made willingly, but sacrifice without choice is not sacrifice, it is slavery. Authority always places demands on people by force. Authority never takes permission. Therefore, not only is it your duty to rebel against the autocracy, it is our obligation to do so for the future generations. To the tyrants, to their puppets, and the ones pulling the strings, I say to you, your time is limited. The people are fed up and starting to see. The veil is in fact lifting. They are becoming aware of the deceit.
Thank you. Next speaker, please.
Hope you guys had a good closed session. I was wondering where my litter box is, but that's fine. Anyway, you know who I am. I use the pronouns rock, paper, scissors. Oh, I thought you were going to put 19 and 20 together, just because you usually do that. But so you want to conduct data-driven analysis on the use of jails with focus on identifying policy interventions that would most effectively and safely reduce San Diego jail populations and better protect public safety through alternates to incarceration. And in response, the BOS approved supporting care coordination for justice-involved individuals through funding and integrated data infrastructure, further demonstrating their commitment to addressing inequities and health disparities that impact individuals involved with the justice system, in line with Live Well San Diego vision of just, sustainable, and resilient future for all. Interesting. So as we talk about things that you guys could do differently, so the first arrest that you guys under this board had was for a woman clapping, and a woman over 60, and you took her to jail. And yeah, and she's an attorney. And then I've been arrested several times here. So I'm just wondering if it would be your policies that you need to actually look at as far as when you're putting people in jail for exercising their constitutional and God-given rights. Because it's pretty ridiculous, and you talk about underrepresented people. I would say that that's us, because you guys don't represent us. You think that we're full of shit, even though we come in here trying to save people's lives and tell you guys, you know, what that we don't like about what you're doing, which is our job as citizens.
Thank you.
But
Next
whatever.
speaker, please.
Mark, there are so many things about this. If the panel over here, if anyone, without taking up too much of my time, just wants to give me a yes or no answer on things, I'd appreciate it. So from what I'm seeing here, obviously the prisoners having access to their Medi-Cal in prison is a wonderful, good idea. I don't know why they would even make a limit within 3 months of them getting out or something, but there are a lot of concerns. There are news stories today about government organizations that have been hacked. So my first question would be, and I know you can't answer this, but how secure the system would even be. And secondly, would this be shared with this separate organization, with the Sheriff's Department separately, or if you were imprisoned, or would it just be automatic because you're on Medi-Cal and now some other organization has your data that's maybe even not that secure and that you never have anything to do with? There are just a lot of things I can see with this that could not be good. And obviously, it opens up a path for you guys to just do a lot more sharing of our data, which is not good. But if it were abused, that is really not good. So those are my main concerns. That anybody on the panel, would it be shared separately? If you went to jail, would it be shared, or is it just going to be shared because you're on Medi-Cal? You like sign a form, you're on Medi-Cal, and now they've got it too, even though you never went to jail. Anyone know the answer to that?
They want to answer questions.
You want to? Well, thank you for being so helpful. As usual, very, very helpful. Okay.
Ms. Consuelo, so.
As usual, very helpful. Did anyone even know the answer? Probably.
We'll now hear from the individuals that requested to speak by phone.
Injustices abound. That's why I'm here. Looking forward to the time I no longer care. This is true. Havlin, that was a great Freudian slip with shareholders. About this item, I would recommend more Venn diagrams so we can have more laughs with this nonsense. This item calls convicted jail inmates justice-involved individuals, just like homeless people now being called the unsheltered or those experiencing homelessness. Soviet-style word games to invert reality, confuse naive people, and reimagine every facet of our country. So, but if substance abuse is not a major component of any county care coordination program, then it will be a complete and intentional failure at permanently reducing the San Diego jail populations, just like the facts stated in the last item. But these supervisors want, quote, a data governance structure and data sharing between programs for this jail population. This infrastructure supports and facilitates sharing data publicly, end quote. Sharing people's data and sharing it in between different government entities. Last year, we heard that the California Department of Health Care Services wants taxpayers to pay for incarcerated criminals to be enrolled in Medi-Cal prior to release by 2023. This item's equity statement says, quote, in San Diego County, white individuals and those who represented other races and ethnicities were underrepresented in all arrest categories in 2021, end quote. Do you supervisors actually want more white and other ethnicities locked up? Underrepresentation is bad, right? Helen, this item says you're at it again, looking for opportunities to share people's data by funding an integrated data infrastructure. This type of item proves that none of you supervisors actually care about public safety. Criminogenic, parasitic, mutants. So I say no to this item.
Thank you. And Chairwoman Vargas, that concludes public comment on this item.
Thank you. I just want to say thank you to our HHSA team, our public safety group, our OAP, and the San Diego Sheriff's Department for all the work on this. I particularly appreciated sharing the story and how you helped us kind of go through the process of what a person goes through, just because this is really about, real folks and real community members who are being impacted. So I really appreciate this, and I agree that having an integrated data system to support care is really what we should be doing and helps reduce barriers for justice-involved individuals that are seeking the resources. So I'm excited about this, and it's the only way we're going to be able to remove some of the systemic barriers that already exist for our communities. And so with that, I'm happy to make a motion and turn it over to Supervisor Fletcher.
Yeah, happy to second. I appreciate the work. And the fragment, look, we have a fragmented, disjointed healthcare behavioral health system. We can't fix that as a board of supervisors, but what we can do is figure out how we can make the broken pieces fit a little bit better together. And it's certainly not an easy process, and it's going to be challenging, but this is the work. If we want to lower recidivism, if we actually want to give people the help and care they need so that they don't come back, these are the things we have to do. Obviously, we're getting some useful tools. The state being willing to reimburse for Medi-Cal for folks that are incarcerated is super helpful, not just from a financial standpoint, but really getting them integrated into care, getting them help that hopefully can continue when they go out. So super challenging work. I don't think any of us are naive about how hard and challenging these problems are, but it's certainly a worthy endeavor, and you have our full support, and whatever else you need as you're working through this, please let us know, because we're very committed to figuring out how we can get better outcomes for folks. Thanks.
Thank you. So we have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Thank you. Just a reminder to the folks who are here today, if you could just please remain civil and cordial to the rest of the folks. I'm going to go ahead and ask our team members from the county to come over for item number 21 to establish the Child and Family Wellbeing Department within the Health and Human Services Agency. Super excited about this presentation. Thank you for all the great work. This is so exciting.
Chairwoman Vargas and members of the board, indeed, we are thrilled to share our efforts to reimagine prevention and protection of services for children, youth, and families. And we request your approval to formally establish the new groundbreaking Child and Family Wellbeing Department as part of the Health and Human Services Agency. This new department is going to transform the way we're able to both serve and improve the lives of children and families. And it is fully aligned with the work your board has already done to increase timely access and culturally responsive support for families, especially those in communities where our help is needed the most, resulting in the reduction of trauma's impact on communities, family breakdown, child maltreatment, and adverse childhood experiences. Just as we flipped our behavioral health system to focus on prevention and continuous care instead of crisis care, we are taking that same approach here in preventing child maltreatment with upstream support like family strengthening efforts, instead of the formal child welfare interventions. These shifts are significant, and they adopt a whole family well-being approach that includes the integration of multiple child and family serving systems from First 5 San Diego, Child Welfare Services, Self-Sufficiency Services, and other departments. They will allow us to better address equity and improve outcomes for kids and their families. To share our work over the last several months to design this new department with robust feedback from our community stakeholders, I am joined by our great agency team with Dr. Kim Giardina, Director of Child Welfare Services, Alethea Aguilez, our Executive Director for First 5 San Diego, and Alfredo Godaro, our Assistant Director for Child Welfare Services. They will each provide key components of the proposed new department. With that, Kim, take it away.
Thank you, Nick, and good afternoon, members of the board. I'd like to start today by asking you a question that most of us probably think is a little bit out there. What if we did not need to use foster care as an intervention to keep children safe? What if instead families had access to all the resources, supports, and services they needed when they needed them from people they trusted and who are culturally competent, so that families could more easily meet their children's social, emotional, developmental, and safety needs? We believe that the creation of the Child and Family Wellbeing Department will get us closer to achieving this vision. In San Diego County, we have started down the pathway to stronger communities and families in a number of ways. Since 1998, San Diego Child Welfare has decreased the number of children in care by 71%, from almost 7,000 children to now under 2,000 children through family strengthening efforts and enhanced engagement. There are many drivers that support this type of transformation at this point in time. Years of work through the Live Well San Diego vision have created improved outcomes, better support for families and communities, reducing the impact of trauma and adverse childhood experiences. Child Welfare Services has undergone systems changes to support and align with the Live Well San Diego vision. And while improvements have been made in reducing disproportionality, Native American, African American, and more recently Latinx children are overrepresented in the child welfare system. Disparities also exist for LGBTQIA+ youth and for fathers. We need to transform our work with families to build trust by creating a system where families can engage with social workers who do not have the authority to remove children and rather focus entirely on enhancing protective factors. Research shows there is a significant correlation between children experiencing poverty and children experiencing abuse and neglect. About 60% of all reports made to the San Diego County Child Abuse Hotline are for neglect-related concerns. The majority of child maltreatment reports come from schools, law enforcement, and medical and mental health providers. And only about 6% of all reports that come from our schools are substantiated for maltreatment. This is the right time to make this change, especially with the leadership of this board through the Framework for Our Future and with new federal funding available from the Family First Prevention Services Act. And now I'll turn it over to Alfredo, who will talk about our community engagement process.
Thank you, Kim. A priority for the Child and Family Wellbeing Department is that all child welfare stakeholders, including staff, lived experts, community organizations, and community members become equal partners in creating and establishing the new department. The success of the Child and Family Wellbeing Department is directly connected to ensuring the voice of all stakeholders who will be impacted by the department is at the front and center as we strategize together. In September and October of 2022, staff engagement feedback sessions were held to discuss the structure, purpose, and function of the Child and Family Wellbeing Department. With the assistance and consultation of a contractor, ICF International, 480 staff members were engaged. Staff's input included the importance of sufficient staffing, training to help understand the new department's vision and staff's role, leadership support, and transparency throughout the transformation. Since October of 2022, community presentations and feedback sessions have been ongoing. We met with the Child and Family Strengthening Advisory Board, service providers, faith organization leaders and legal partners, child and family advocates and lived experts, such as the current and former foster youth, caregivers, and parents. Some of the feedback included making available the basic needs so families can help themselves, ensure resources and services are available in various languages and in their communities, and continue to engage the community members to provide updates on our progress. In child welfare services, we have historically spent the majority of our funding supporting foster care as a primary intervention to keep children safe. A much smaller portion of funding goes to support prevention and family strengthening efforts. But by turning our child welfare system upside down with a focus on equity, prevention, and supporting working families, we can provide families with the supports they need before foster care becomes a necessary intervention for keeping children safe. While we will focus on strengthening families and preventing children from entering foster care, some youth will still require foster care as an intervention to keep them safe. However, this should be a significantly smaller number of youth, and foster care should be the last and smallest intervention that we use to support families. For children who do need to enter foster care, we need to equally focus on the well-being of children and families and focus on equity in our foster care system. The vision of the Child and Family Wellbeing Department is to increase protective factors to reduce the likelihood of child abuse and neglect, and improve child and family well-being through strength-based, family-centered, trauma-informed, and culturally responsive services. Alethea will now share some background related to prevention efforts.
Thank you, Alfredo, and good afternoon. We aim to lift up our children and their families by providing a range of coordinated and integrated prevention services. Primary prevention activities are directed at the general population to strengthen communities and improve child well-being by focusing on the social determinants of health, defined as the conditions into which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. Secondary prevention activities are offered to populations that have one or more risk factors associated with child maltreatment, such as poverty, parental substance abuse, young parental age, parental mental health concerns, and parental or child disabilities. Programs seek to provide access to services and resources within communities having a high incidence of any or all of these risk factors utilizing data. Tertiary prevention activities focus on families where maltreatment has already occurred and seek to reduce the negative consequences of the maltreatment and to prevent its reoccurrence. These services provide supports and resources to children and families involved in the child welfare system to prevent reentry and reoccurrence. There are prevention support services available countywide for children birth to 5 years of age and their families that are offered by First 5 San Diego that include but are not limited to serving pregnant individuals as early as possible in their pregnancy, family support programs that include home visiting, access to high-quality early learning, and supporting the healthy development of all our babies. Additionally, a new fundamental shift towards prevention is the new Family First Prevention Services Act that was signed into law back in 2018 and changed the landscape of Title IV funding distribution. Part 1 of the Family First Prevention Services Act allows jurisdictions up to 50% cost reimbursement from the federal government for the provision of preventative services to families. This new form of funding distribution allows jurisdictions to provide more services to families in need. Eligible services include substance use disorder services, mental health services, in-home parenting supports, and kinship navigation. These services are designed to prevent the need for families to ever make more contact within the child welfare system. Achieving these fundamental changes requires a new approach to not simply honing the current system, but replacing it with a more holistic, equitable, and trauma-informed methods. I will now hand it back to Kim to talk about anticipated outcomes.
Thank you, Alethea. Through restructuring operations and creating a vision of a better way for child and family well-being, we expect to realize short-term outcomes, including increased collaboration and communication among agencies and community-based organizations to ensure families have equitable access to a continuum of prevention and strengthening services, reduced number of individuals on wait lists for services, improved protective capacity of parents, increased awareness of new processes for receiving prevention services, and an increased number of families accessing prevention services. After realizing these initial outcomes, we expect that in 2 to 5 years, we will begin to see decreased rates of disproportionality and disparities, improved health and well-being equity outcomes for children, youth, and families, increased family strength, resilience, and sustainability, reduced child maltreatment, entry into foster care, and unnecessary child abuse hotline calls, and enhanced sustainability of funding and programming for prevention services. I'll now hand it back over to Nick.
Thank you, Dr. Jadina, Alfredo, Alethea, and Patty K. Dan, our Chief Operating Officer, for your passion in serving families and kids and your tireless work in reaching this point. We know function dictates structure, and this is a high-level organizational structure of the reimagined Child and Family Well-Being Department that's part of the Health and Human Service Agency. Starting at the top right, the Child and Family Strengthening Advisory Board will have oversight over the new department to support cross-sector collaboration and transparent monitoring of the department's work on family strengthening and prevention services, especially on racial equity, culturally responsive support services to families of color. The role of the advisory board's Foster Alumni and Youth Community Empowerment Subcommittee will also continue to provide critical partnership of lived experience. The heart of the changes will be in the offices within the Child and Family Wellbeing Department. The department will consist primarily of the new Office of Child and Family Strengthening and the Office of Child Safety. These two offices will be supported by Critical Administration Branch and the Ombudsman, as well as our Child Health Officer and County Council. Now, the Office of Child and Family Strengthening will encompass First 5 San Diego, Prevention and Preservation Services, and the Child Care System. As part of the Child and Family Wellbeing Department, First 5 San Diego will continue to reach families countywide by leading systems of change efforts supporting the health and well-being for children ages birth to 5 years of age. San Diego County has long invested in resources and prevention services to provide family strengthening services to families, including Partners in Prevention, the Family Strengthening Prevention Initiative, and the Cash Transfer Program for youth at-risk families. The Office of Child and Family Strengthening will continue to support these prevention and family preservation services and explore new initiatives that will build upon this work, such as the Family First Prevention Services Act. In order to provide a holistic approach to enhancing and sustaining a quality early child care and education system in San Diego County, the child care system under the new department will integrate existing efforts, including the San Diego County Child Care and Development Planning Council, our Child Care Workforce Investment Program, our Child Care Shared Services Alliance Program, and the forthcoming Child Care Blueprint. These efforts will ensure families have child care that's accessible, affordable, and reliable. Now, the Office of Child Safety will continue to provide all programs and services currently administered through Child Welfare Services. Social workers will continue to partner with children and families to access the safety of children who have been alleged to have been abused and are neglected through investigations. For families who have substantiated child abuse and neglect, they will be provided with case management and intervention services to either maintain children safely in their home or work towards returning the children as quickly as possible when safe to do so. Social workers will continue to ensure that all children in care achieve permanency and provide transition services. This infographic is a different representation of how we're bringing different pieces of the puzzle, family serving systems together into this new department. Very importantly, it includes both prevention and protection services that we've been talking about to create a holistic approach to engaging with the community, building on the family's strength and expertise, and creating a prevention pathway. There are many core programs that will be integrated with the launch of the new department that we've spoken to, like First 5 San Diego programs and child welfare and child care. But I also want to point out that there's some blank pieces here, intentionally. They signify that we anticipate to evolve and grow as we continue to hear from staff and the community on how we can better respond to families' needs. We will engage in a continual process to look at how we can leverage existing programs within the agency and the county with a great focus on resources and better outcomes that complete this puzzle. After the board's action today, Child Welfare Services and First 5 San Diego will continue to work to begin the reorganizations into the Child and Family Wellbeing Department through continuing to engage our staff and community partners to incorporate their voice into the development of the department, receiving and reviewing the business process reengineering plan from our contractor, ICF International, which will include a detailed phased implementation plan and data to support staffing numbers and recommendations, and finalizing the evaluation framework for the Child and Family Wellbeing Department in collaboration with our County Office of Evaluation, Performance, and Analytics, and ultimately beginning the transition and implementation in July of 2023. Of course, the work will not end there, and we will continually evaluate progress of the department to ensure we're doing the best we can to strengthen families and help them be successful. So today's actions request authorization to create the Child and Family Wellbeing Department within the Health and Human Service Agency, inclusive of the Child Welfare Services, First 5 San Diego, and additional programs, as I mentioned. Authorization to make any changes necessary to support the reorganization and partnership of Child Welfare Services and First 5 into the Child Family Wellbeing Department. I want to thank the board for your vision and support throughout this entire process of this exciting transformation. Supervisor Nathan Fletcher and your state of the county put the challenge to get us to this point. Our community partners have come together tirelessly in reaching this. We look forward to continuing the partnership with all of you with the board and all of our community members to strengthen families and to prevent child maltreatment. Thank you for the opportunity. This concludes our presentation and available for any questions.
Thank you. Supervisor Fletcher?
Yeah, thank you. Today's really a culmination of years and years of work. You know, the Family First Services Act provided a fundamental shift in what we did. But that shift really has to be embraced. It has to be operationalized. And I believe we're the first jurisdiction moving forward with actually doing this, perhaps the first in the nation, to fully embrace it and create a Department of Child and Family Wellbeing. And I loved the pyramids. If you've been to our behavioral health briefings, it's much the same concept. The need to remove a child should really be viewed as our failure to help intervene and support that family. We'll always be there if a kid if they're in danger and they're at risk, you know, we will always be there to do that. But to have that shift and have that coincide with the reduction of number of kids, but also to have it coincide with really what the board has committed in partnership with Child Welfare over the last 4 years. In 2019, we created the Child and Family Strengthening Advisory Board. Again, child and family strengthening, which is very similar to what we're doing right now, child and family well-being. We implemented all 88 recommendations that were put in place. We expanded services for caregivers. We expanded services for families. We hired exponentially more staff. We better supported the staff that we have, and we've really, really worked tirelessly to get us to this point. I love the integration of First 5 coming in, and everywhere that we're going. And Kim, I want to commend you and your team because it's been a lot of work over 4 years since you've been the director, and what you've done has been incredible in terms of the direction we're moving, the support of the employees, but also the support of the broader community. There are so many folks out there who are involved and professionally and personally committed to looking out for kids, you know, the least among us, who, again, everyone kind of moving together, and it didn't start that way. We had a lot of friction when we started this, and we've now got an effort that is really moving in a positive direction, and so I'm really pleased. And sit in a unique spot. I'm very fortunate to both serve as chair of the Child and Family Strengthening and First 5, and I'm very excited about seeing the implementation of this, of everything we can do. So Nick, Kim, Alethea, your whole team, and everyone who's there, we have a ways to go. But today's date is not just a renaming. It's not just a reorganization. It really is a reorientation around a fundamentally different strategic goal and mission. And so it is significant in that regard, and it really is a continuation of so much work that's been done. So pleased to move the recommendations, and really excited to continue to see where this all goes.
Thank you. And I'm happy to second it, Supervisor Fletcher. I too am very excited about this. I mean, in the end, we have a responsibility to do everything we can to make sure that all of our children are, you know, experiencing a positive childhood and that they have the opportunities to succeed. And so I'm really excited about this. And I also think that this sort of demonstrates, you know, this concept of, you know, reimagining what government can actually do to work for all and not just for some, right? I think often we have had so many barriers in making sure that we're providing resources and services for our communities. And so the way that this has been so thoroughly thought through, I think will make a really big difference for our kids. And you know, honestly, we can't have a strong workforce if we don't have, you know, children who have the best opportunities in order for them to succeed. And so I think it all is in one way or another related. So congratulations to all of you for the great work. Happy to second it, and we're going to go ahead and, if you don't mind, we'll go to public comment, and then we'll come back to my colleagues for any additional comments. But thank you for the great work.
Thank you, Chairwoman Vargas. We have 17 requests to speak on this item, 7 in person and 10 requesting to speak by phone. Also note for the record that we received 10 e-comments, 9 in favor, 1 in opposition. Any members of the public that requested to speak on item 21 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, starting with those in favor of this item. As your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak. I'd like to invite forward Crystal Irving, Catherine Rhodes, and Sandra McBrayer. You'll have 2 minutes to address the board. I'll ask you to please state your name for the audio record. You're welcome to come forward in any order. And those speakers will be followed by the individuals in opposition: Audra, Consuelo, Paul Hankin, and Mark.
Hello, my name is Crystal Irving. I'm president of SEIU 221, and I believe you all know that prior to becoming president, I served as a protective services worker in child welfare services and served on the Child and Family Strengthening Advisory Board. So I know all too well the commitment and importance of protecting all children. It was always my position that we should be working our way towards a system that looks much different from child welfare services because we've eradicated child abuse and neglect and provided parents with adequate resources and tools to do a job that unfortunately has no manual or instructional guide. I'm here today hopeful and in support of this item. This builds on the work led by Supervisor Fletcher, the Director Kim Giardina, and the Child and Family Strengthening Advisory Board, which has been a catalyst for significant changes within CWS and the families that we serve. And we're grateful for the support and pleased with the progress while acknowledging there's still work to be done. And as social workers, we know there can be multiple truths. We know that the pressure and toll on mental health has increased exponentially during the course of the pandemic, and it directly impacts our clientele. And we've also seen too many county initiatives announced under the banner of integration and connecting resources that resulted in unintended consequences of more work and more bureaucracy for workers and those that are most vulnerable and in need of relief. So I'm encouraged by the community engagement that informed the development of this department and the focus on the preventative services, which is much needed. So we're in support of moving forward with this item with a reminder to the board and county leadership that if we want this new department and new approach to be effective, folks must continue to roll up their sleeves, engage with our members, stakeholders, and the children and families we serve on details big and small, on progress and pivots, so that we can ensure the well-being of children and provide all of our children with the opportunities they deserve and their right to thrive. Thank you.
Next speaker, please.
Good afternoon. My name is Sandy McBrayer, Chair Vargas and members of the board. I'm excited to be here today because it's innovation, it's support, and it's true focus on prevention. We know that families don't live in silos. We know that accessing services and programs based on funding streams is unproductive and frustrating. And having a single team that says children and families are our focus, to actually philosophically say, how do we help them before they need that high level of service? Not let's get them from here to there, but let's get in front of the issues. Let's figure out, do you need clothes? Do you need shelter? Do you need housing? Not, oh, you don't have it, so now you're in trouble. It really is a philosophical change, and it is the first to be able to say, we are going to prioritize prevention. We aren't going to wait until the most needy need us, but we're going to figure out how to be in front of them. And when we say we, what you heard today wasn't just the county. It has been years of community partners. It has been years with foster youth having such a strong voice with faces. Resource families coming together and saying, this is what we needed. When we asked foster youth, alums of foster, and said, what did your family need before you were taken away? They have real answers. and we can provide those things. And so this innovation, this support, this focus on prevention is just a continuation of this board's efforts to say all kids and all families matter. It's the work of Nick and Kim, who have said, I'm not giving up. Just because this is the way it's done doesn't mean it always has to be done this way. And so I am pleased to be a partner with the county, with this new department, to say, how can we help? And I can tell you that there are so many families and so many community-based organizations who are just as excited. So thank you.
Thank you. Next speaker, please.
Mark, a new government program, what could go wrong? Well, obviously, there's a lot of good this program could do. I'm not going to say I'm totally against it or anything. Although, as a corporation, you usually have an incentive to make money. For instance, if there's a child in the program, you get paid for it, or an organization does. So there's incentive for people to want children to be in the program. I'm not sure I like that. I definitely don't. And also, the government can be very invasive. And for instance, it might have been 8, 9 years ago, a friend of a friend was telling us how his kid was in elementary school, and they're asking the kids if anybody at home has a gun. There's just so much room for the government to stick its nose in parents' business to degrees that aren't okay. I mean, it could just be a parent cleaning his legal gun, that, you know, and Johnny walked in and he said, yeah, Daddy has a gun, he's cleaning the gun or what. Or there's so many ways that this could be abused, and it usually is eventually in some way. Obviously, it could be a good thing. Also, I had a friend, this is probably 25 years ago, she had a roommate. It was actually a friend of mine's ex-girlfriend. And her roommate, eventually, you know, they were friends, they were roommates. She left the kid to be babysat for a little while. And he took a picture and touched the kid wrong. He didn't rape the kid or anything like that, but it was inappropriate, and he got busted like he should. Only problem is, she got punished, and it took her like 12 years. The kid was 6 at the time, didn't get back in her custody until he was like 18, 17 or 18 years old. There's a lot of...
Next speaker, please.
Hello, my name is Lyon Paul Henkin. I thought that HHSA was already about protecting the well-being of the child and family. The agenda says there is an imperative need to transform the child welfare system toward prevention with a focus on the earliest of interventions and an overall change to a more equitable approach to reducing child maltreatment. Well, maybe one of you or maybe Nick or someone can answer this, but what is the child welfare system doing if not this? I mean, sounds like we're wasting a lot of money setting up a special department for what we're already doing. And then the board has the absolute nerve to use 3-year-old 2020 Sandag data in the equity statement to justify this move. Talk about another data-driven flop. Can it not even afford a data update? Well, the state is running a huge deficit, and our finances are going down the drain. A department of duplicative services is bound to be a huge waste of our tax dollars. Please, you need to reject this wasteful measure. Thank you.
Next speaker, please.
Consuelo, they don't care about the children. They don't care about the seniors. They don't care about the homeless. People have come to love their oppression. There is no authority on earth that can rightfully govern your life. Born to this world, you and you alone control your eyes, ears, tongues, hands, and mind. All authority which claims to be able to dispose of you and your abilities is deceit. You were born to this world so that you might have the free agency of life. Life is liberty. With liberty and trust in this world, you can learn and do anything. Anyone who tells you that you must yield your mind, your body, and your possessions to authority is evil, wrong, bad, wicked. Understand that the choices made of your own free will are not evil. There is nothing wrong with sacrifice if it is made willingly. But sacrifice without choice is not sacrifice. It is slavery. Authority always places demands on people by force. Authority never asks permission. Therefore, not only is it your duty to rebel against the autocracy, it is our obligation to do so for the future generations, the children. To the tyrants, their puppets, and the ones pulling the strings, I say to you, your time is limited. The people are fed up and starting to see the veil is in fact lifting. They are becoming aware of the deceit. Once the masses have caught on to what government and the politicians have been doing, watch out, it's game over. Government to steer, to control, mind control. Politicians, politics, poly, many, ticks, blood-sucking parasites. Their false flags do not work anymore. We are awake. Babylon and the Roman Empire, they never fell. They just changed their names. We, the few but mighty, are making it known. We are making sure their one world order.
Thank you. Next speaker, please. Your time is up. Next speaker, please.
Hello again, you know my name, I use the pronouns rock, paper, scissors. I find this really interesting. Nathan, you brought this forward in March of 2022. Here we are in 21. It's taken you a year to bring this forward. Good for you. But then I wonder, it's so interesting that you're really good friends with John Podesta, who is a known pedophile. And you are sitting here wanting to get into child welfare. That's interesting to me because you want to deal with reduce child maltreatment. And on another topic on that, everything that you guys are doing in the county to destroy children's lives, like, I don't know, we have a governor who is producing pornographic videos and giving them to kids. Good on him, right? Because, I mean, they need to learn about sex at any age and just, you know, whatever, as long as we can brainwash them. But thank you for your propaganda update. It was really informative. But it just shows that, I mean, the fact that you have YMCA in a partnership in this when they're engaging in all of this child maltreatment is interesting. So it's like you guys have all these people that don't actually care about kids. The child welfare system is part of trafficking of kids and abuse on them. So the fact that we're like, yeah, let's pretend, like everything you do, it sounds good. It really sounds good. It sounds like a pretty little package. And I'm like, that looks good. I want to buy it. It looks like a diamond ring. What? And then when you open it up, it's fucking coal. Okay, everything that you guys do is tainted. It's tainted and it's evil. And the fact that you want to engage with kids when we're sitting here indoctrinating them with like CRT and like trans, you know, genderism, and you can be whatever you want, you know, like we're going to go take you to get an abortion. We don't have to tell your parents, and we're going to go and take you to get gender reassignment, but we don't have to tell your parents. So if you like die at home.
Thank you. Your time is up. Final call for Catherine Rhodes. We'll now hear from those that requested to speak by phone. When it is your turn to speak, you'll be unmuted and you will hear a recording that will tell you to begin your comments after the beep. I'll remind the callers they should mute their TV or live video stream before they begin speaking. We'll start with our first caller.
Martin Wisi, thank you to Chair Vargas, Board of Supervisors, and staff for bringing this item forward. As an employee of SAY San Diego and proud member of the Children First Collective, I'd like to state my strong support for the creation of the Child and Family Wellbeing Department. Creation of this department recognizes and targets the growing hardships faced by many of our local families and is a critical step towards meaningfully improving the well-being of our families and children, the workforce that cares for and educates them, our child care infrastructure, and ultimately the regional economy. With your support, the new department will be able to use its powers of coordination, integration, and state and federal grant seeking to move San Diego forward. Thank you.
Thank you. Now hear from the next caller.
Good afternoon. Thank you to Chair Vargas, Vice Chair Lawson-Remer, and Supervisors Anderson, Fletcher, and Desmond for this opportunity to speak, and especially to county staff and ICF International for your diligent work in pulling together this recommendation and organizational structure for a new Child and Family Wellbeing Department. As Director of San Diego for Every Child, co-lead for the Children First Collective San Diego, a mother myself of a precocious toddler, and a committed advocate for children, working families, and child care providers, I could not be more thrilled with this proposal. We know that to make transformative positive change, it often comes down to two things, internal infrastructure and budget. The creation of this department is a strong step in that direction. With an explicit facet for the local child care ecosystem within the Office of Child and Family Strengthening in tandem with First 5 San Diego, it will help prioritize and coordinate the strategy for a local response to our child care crisis. It's something felt locally, so it makes sense to have a local infrastructure to help address it. And with the holistic and foundational work of the LPC paralleling imminent action steps coming from the county's child care blueprint, this office and department will deliver long-term accountability on an issue that impacts everyone in our region, whether they have children or not, because the health of our child care sector denotes the health of our local economy, as well as the essential development foundation for San Diego's future generations. Thank you again to our Board of Supervisors, and we strongly support this proposal.
Thank you. For the record, that caller was Aaron Hogaboom. We'll now hear from the next caller.
Good afternoon. My name is Rick Richardson with Child Development Associates and a First 5 Commissioner. Chair Vargas and Supervisors, I wholeheartedly support the creation of the Child and Family Wellbeing Department. In particular, the Office of Child and Family Strengthening will help prioritize local resources and to strengthen infrastructure and staff support for the local child care ecosystem. Today, dedicated child care providers are underpaid and leaving the profession, causing a staffing crisis. San Diego families are counting on us to provide opportunity for all children. And without child care, we know San Diego parents can't work. I applaud the county leaders for their vision to address inequities and improve outcomes. This department will create a structure for coordinated and integrated delivery of services and cross-sector collaboration. The new department will also support implementation of needed recommendations from the County Child Care and Development Planning Council and also help implement the forthcoming County Child Care Blueprint. I urge you to vote yes for item 21. Thank you.
Thank you. Now hear from the next caller.
Good afternoon, Kathleen Lippitt here. I applaud the focus of concern on child and family well-being. However, there are two factors that are primary drivers of child welfare issues, and that is they are parental drug abuse and single-parent homes. These factors are shared by every socioeconomic, cultural, and racial group. Government bureaucracies have been responsible for policies that have failed to address these issues. My mother was a social worker during the time when welfare recipients were told they would receive more money if there was no father in the home. The predictable outcome was fathers leaving the home to increase the amount of available government money the mothers received. Over time, fathers no longer anchored to the home or family went on to create new families, leaving their children without the benefit of being raised by two parents. The issue of parental and guardian drug abuse is also a significant factor in child welfare issues. The history of marijuana abuse has been found to be the #1 factor associated with child abuse, neglect, and fatalities in the states that do child fatality review reports. This board seems to still support maximizing the availability and use of marijuana, which is the high THC drug that contributes to the drug journeys of so many adolescent and young adults. Please reconsider your conflicting policies such as these. Thank you.
Thank you. Now hear from the next caller.
Truth. Once again, we have another item that uses the World Economic Fascist Forum's term transformed. Hence why Klaus Schwab's wife wore a butterfly brooch on her jacket at their annual meeting, Nathan, you pyramid lover. This item intends to, quote, move beyond the status quo, to undertake a fundamental transformation, to transform the child welfare system, end quote. Progress feels a lot like regression, and transformation looks a lot like destruction. The county contracted with ICF International to create the Child and Family Well-Being Department within the Health and Human Services Agency. ICF International is based in Virginia and works in areas such as PR campaigns for companies like Skittles. They also work with federal agencies such as the EPA, the U.S. Forest Service, and the USDA. In 2007, after Hurricane Katrina, ICF International was hired by the state of Louisiana to dispense federal road home program aid to people whose homes were damaged. But out of 101,000 applications, they handed out less than 300 grants. Their travel expenses alone cost the taxpayers $19 million. ICF's board of directors includes a former senior VP of HP, a National Academy of Medicine member, and a Novartis board member. On their website, they talk about building a sustainable and low-carbon future, GHG measuring, transportation electrification, state and local decarbonization, carbon trading, connected and automated vehicles, bioinformatics, and public health surveillance. ICF actually did an environmental impact report for San Diego's regional plan. And as far as the first 5 commission, their members include the likes of 3D Giving the Illusion of Depth, Nick Machione, and Wicked Wilma Wonka of the West. So you know children are going to suffer under these transformations. So Helen, what's going on with you being involved in these last nefarious items? That's your retirement legacy? Come on. Somebody please think of the children.
Chairwoman Vargas, that concludes public comment on this item.
We have a motion and a second. Supervisor Desmond.
Thank you, Chair. Appreciate it. I just want to say thank you very much to the staff for the great presentation. I think this is a good step forward, in ensuring children and families receive the services and the supports in a timely manner, and hopefully before they become homeless and on our streets. So I really applaud you for putting this forward, and I look forward to future updates and positive results. So thank you very much.
Thank you. Vice Chair Lawson-Remer.
Thank you. Thank you so much. It's a great job, but I think I wanted to just speak a little bit more broadly about how much I appreciate the innovation and the initiative, right? Not just kind of being responsive, but really being proactive and having, taking a really creative approach to say, how do we do better, right? How do we get ahead of this? How do we be in front of the problem instead of just being reactive on the back end? And it's a lot easier and safer to be reactive, right? It's a lot easier and safer to just do the minimum that's required and to check a box. And I think this initiative is a real example of you all doing so much more than checking a box, really kind of imagining how do we deliver for our kids. So thank you for, I know how much more work it is and how much harder it is to push the envelope, and just please keep pushing the envelope.
Seeing no other comments, we have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
Thank you. And again, thank you for your presentation. It was very, very helpful. All right, the next item on the agenda is item 22. It's the Employee Engagement Survey Enterprise Report, and I'm going to give our team a minute to join us up here so that they can do a presentation. All right. I'm going to go ahead and hand it over to Susan.
Thank you, Chairwoman Vargas and members of the board. In September of last year, the county partnered with an engagement expert, CPS HR Consulting, to conduct the first of our biannual employee engagement surveys. This first survey...
Give me a second, Susan. Excuse me. We're starting our presentation. Can you please, if you have any conversations, take them outside, please? Thank you. Please either join us or take your conversation outside so I can go ahead and give our colleagues the respect that they deserve.
Thank you. This first survey will serve as a benchmark for future surveys and guide our efforts around employee engagement now and in the years to come. All of our labor partners were invited to meet with our consultant to provide input into shaping the survey questions. SEIU met with CPS in July and provided valuable feedback. We will continue to include labor in our employee engagement process. Chairwoman Vargas asked that we share the results with your board today, which will serve as our roadmap for engaging with county staff at all levels of the organization. Now is when the work begins. Each department has received their engagement scores and have been asked to develop a work action plan, which includes input from employees, and to set long and short-term goals to address key areas where they scored lowest in engagement. Countywide, we will be hosting a series of listening sessions to solicit feedback from all county employees, which will also contribute to the overall action plans developed by the departments. Now, I would like to introduce Judy England Joseph from CPS HR, who's joining us remotely to present the summary of the employee engagement survey findings.
Thanks, Susan, and thank you so much to everyone to allow us to present the results of the 2022 employee engagement survey. As you know, probably that we did the survey back in September of 2022, and we had a very solid response rate of 51%. That means 608 employees responded to this survey. It's a stronger response than in previous surveys that we understand the county has conducted, so that's why we feel this is a really good response rate for this survey. There are 6 questions that we focused on in engagement. You can see them on the right. Those 6 questions are the questions that we're interested in understanding in terms of the level of engagement of the employees. This survey was a set of statements, and people were asked to tell us whether they strongly agreed, neither agreed or disagreed, agreed or strongly disagreed, and sometimes no basis to judge. It was the basis of the calculation of our engagement score based on how people responded to these 6 questions. And how they responded to these 6 questions was the basis on which we came up with whether the respondents were fully engaged, somewhat engaged, or not engaged. And I'll talk a little bit more about that in a minute. So overall, for countywide, the engagement level was 37%. The gray group is the somewhat engaged, and the red or burgundy level is 16% not engaged. Again, this is based on those 6 questions and how people responded to them. If they responded positively, meaning agree or strongly agree to those 6 questions, they fell in the fully engaged category. If they were somewhat engaged in terms of those 6 questions, then they would have fallen into the gray area. And if they disagreed or strongly disagreed, they fell into the red area. So there were a number of other questions besides these 6 engagement questions. They covered these 10 categories on the left. There are a number of questions within each of these categories. We looked at and analyzed these categories of questions in relationship to the 6 engagement questions. We did a multivariate regression analysis to identify the key drivers of engagement based on how people responded to these other questions. And I'm going to walk you through the categories of questions and how people responded, and based on the analysis, what we believe are areas needing improvement, where we want to maintain because the scores are high. And in both of these top 2 boxes, they are high influencers of the way in which people responded to those engagement questions. The bottom 2 boxes are lower influencers of engagement, and they were either low scoring or high scoring. But as we walk through this, you'll see a little bit more about what I'm talking about. But we're focusing primarily on the top 2 boxes. So these are the question sets that we asked. And in our key driver analysis, what we identified was that that pink bubble was the one that was the strongest influencer of engagement. And that pink bubble represents the questions in the diversity and inclusion category. The second most powerful influencer of engagement was the county's vision. And then you can see there's a purple and a pink, a darker pink bubble for culture and for training and development. So I'm going to walk you through some of the individual question sets so that you can see which questions in each of these question sets were the greatest influencers of engagement. So here is the diversity and inclusion set of questions. There were 4 of them. You can see them on the bottom. But what I wanted you to focus on is the yellow bubble. The yellow bubble is telling us that that question, I feel like I belong here working for the County of San Diego, was not only the most influential of the questions as it related to engagement, but it was also high scoring because 80%, between 78 and 80% of the people responded that they agree or strongly agree with that question. In the county's vision category, again, the yellow bubble represents, I feel I can make a difference by working here. And that was the most powerful influencer for engagement. And so it tells us that people feel very strongly that they have an opportunity in their jobs to do something that's really meaningful and that they feel very proud of it. The second bubble down there, just below that, the county's vision is important to me, also fell into that maintain category because things are going well. This is where we begin to see that the bubbles are moving towards the left, meaning that we need to start paying attention to what we might need to do to improve. And here you can see, again, the one that's solidly in the top left box is that pink one, and that's for the question, ideas from employees are valued. So about 58 to 60% of the employees agree with that statement, which means that there are, 40 to 50% of the people who did not agree with that statement. And it's a powerful influencer of engagement. The purple is right there straddling the line, I feel valued for the work I do. It's also a strong influencer of engagement, and we're doing pretty well, but we need to maintain it and continue to work towards moving it to the right. Training and development was the 4th area of questions where they were very influential in terms of engagement. Here again, we have a couple of bubbles that are in the need improvement area. The pink one says training and development activities I have completed in the past 12 months have helped to improve my performance. So that question is difficult for us to figure out in terms of what people might be saying, but what it's telling us is we need to focus more in depth into understanding what might be the reasons why people feel we are not doing enough in the training and development area in order to help them improve their performance. And I'll talk about that question a little bit more in a second. The yellow one is, I feel that there are opportunities to move to different departments within the county. That's telling us that people feel committed to the county and they want to look for opportunities to expand their expertise to maybe have opportunities for upward mobility. That's a very healthy indicator for people who want to stay within the county but may want to move from where they are. So of the bubbles that were in that top left category, top right category for maintain, I just want to draw your attention to the top 3 strongest, most influential statements for influencing engagement. They were, I feel like I belong here working for the county. I feel I can make a difference by working here, and I feel valued for the work I do. Helen and other senior executives in the county have heard me say, this is a real indication of something that the employees are saying, not what top management's saying, not what a PR firm is saying. This is what the employees who responded to the survey are saying about how they feel about working within the county. If I were you, I'd be putting this on your webpage. This should be the way in which you advertise for jobs to try to draw people to the county, because this is the voice of the employees speaking. Now, areas needing improvement, here are 3 of the areas that we need to improve. One is ideas from employees are valued. The second was that training and development activities question about whether to improve my performance in the past 12 months. And I feel that there are opportunities to move to different departments within the county. So these were low scoring, but high power in terms of influencing the engagement score. It means we need to pay attention to these three. The problem with the second question is that we don't know, are we talking about formal training? Are we talking about professional development? Are we talking about something that was not accessible in the past 12 months because it wasn't available easily for people depending on where they worked? We don't have enough information, formal training or OJT. So this is a good example to illustrate to you that surveys can tell us a lot, but they don't tell us everything that we need to know. And it's important for us to delve deeper. Don't just take survey results and assume that that's enough for us to act on them. We need to get behind these. We need to get more information. We need to triangulate information to help us understand, are we getting to root cause so that we are assured that the actions we're taking are going to really solve the problem. I thought that you would be interested in the highest scoring questions as well as the lowest scoring questions. So these were the top highest scoring questions. There is at least one person at work I can rely on for guidance and support. I know what is expected of me on my job. 90% of the employees responding agree or strongly agree with that statement. I like the kind of work I do. Nearly 90% said they love working for the county and the type of work that they are engaged in. My supervisor is available when needed, and people on my team cooperate to get the work done, to get the job done. Those were 86%, almost 87% positives. This is all really positive in terms of what kind of work environment people feel they are a part of. It's very healthy in terms of the way in which they see the atmosphere for where they work. Now, these are the lowest scoring questions, and I think this is important for a number of reasons. I feel that I know enough about the work of the other county departments to make a decision to move to another department. 45% of the people agree with that, which means 55%, more than half, did not agree with that statement. I believe that information flows well from leadership to frontline staff. Almost 50% agree with that, but that means 50% did not agree with that statement. This is what I'm most concerned about. It is safe to challenge the way things are done. 50% agree, but that means 50% don't agree. We need to understand what is it about the environment in which they work that makes them feel that they cannot speak up, that they feel for whatever reason, it could be retaliation, it could be being set aside for projects and opportunities, being blackballed for whatever they're doing. We need to do a lot more to understand what's behind this, because this is a significant indicator that we want to ensure, if half of our people feel this way, that we need to work on it. I believe that information flows well from frontline staff to leadership. 52% agree with that, but guess what? 48% don't. And departmental leadership values my ideas and input. This is the first question that I'm bringing up to your attention about departmental leadership versus countywide. And 52% agreed with that, but that means 48% did not. It's a great opportunity for departmental leadership to focus on what's happening, both in terms of how we're listening to people and what kind of environment are we creating so that they feel comfortable bringing things to our attention. Now, the thing about these low-scoring questions that I think is important, you had a lot of positive responses, a lot of really good news out of this survey, but we also got a lot of information about things people weren't happy with, and that's where we have an opportunity in terms of action planning to address them. I also added this slide because I thought you might be interested. There's always a lot of issues about where do I work and whether I can work remotely and whether I have to work on site. And here are the 4 types of work assignments or locations that people might work: on-site versus remotely, hybrid schedule or not. And what I wanted you to note is that the engagement level was really no different, no matter where those people worked. So there isn't one type of work environment or location that people are happier about in terms of soliciting or eliciting more engagement than another. This tells me that your leadership and I'm talking about supervisors, managers on up, have done a really good job of working with staff to understand why where they work is so important in meeting the needs of citizens. So in terms of actions and next steps, I've already done presentations to all the senior leadership. I did that back in November and December. We've provided them with online data and tools, in addition to helping them with some initial action planning suggestions and ideas. We have done some group level conversations in terms of action planning, and that's ongoing. On the 29th of March, I'm going to be speaking at a town hall of diversity and inclusion as it relates to engagement and ethics. But the idea here is it'll be the first opportunity for me to talk about the results of the survey to the employees, since everyone I've been talking to have been in senior leadership positions. And the last thing I wanted to mention is that one-on-one department level action planning assistance as needed and requested, we will be providing between now and May. So that's it in terms of what I had to offer. I'm happy to answer any questions that you might have, but I want to turn it back to Susan and to the county staff for the rest of the presentation.
Thank you, Judy. The recommendation before the board today is to receive the employee engagement survey. And that's it for the presentation, subject to your questions.
Thank you. Thank you. I have some stuff to say, but I'll wait until after public comment.
Thank you, Chairwoman Vargas. We have 5 requests to speak on this item, 3 in person and 2 requesting to speak by phone. I'll also note that we received 1 e-comment in neutral. Any members of the public that requested to speak on item 22 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, starting with the individual in favor of this item. I'd like to invite forward Crystal Irving. Crystal, you'll be followed by the speakers in opposition, Audra and Paul Hankin.
Hello, Chairwoman Vargas and Supervisors. I'm Crystal Irving, President of SEIU Local 221. This item is critical to our members, and we've said many times before that the new values and policies of this board have not translated to changing legacy county culture and the day-to-day experiences of our members. In reviewing some of the results, I want to highlight 2 areas. I was pleased but also surprised to see the strong numbers of staff that responded that the county values diversity, equity, and inclusion, which I have to say doesn't quite match the countless stories that we hear from our membership about favoritism, disparate treatment, and microaggressions that impact their workplace. And according to the county's most recent diversity and inclusion report, the race and ethnicity breakdown of the workforce was 7.5% Black and African American, 19.2% Asian Pacific Islander, 35.1% Hispanic, and 37.6% white. And it is important to take these stats into consideration, as data like this can easily and unintentionally be skewed in standard data collection processes because they amplify the experiences of groups who are numerically a majority, and potentially drown out the experiences of the numerically smaller groups. I also want to highlight where the survey quantified that training and development issues, as we at SEIU continue to raise this issue, that there is real work to still be done on training, especially for our new employees, and that there are insufficient opportunities for career growth. So we have 2 recommendations. First, SEIU would like to partner with the county on the next steps of soliciting feedback from employees, organizing the listening session, and developing an action plan to dig deeper into truly assessing where the county has made strides, where the county has fallen short, and the next steps as we continue to work towards a new standard for county culture. Second, we know that an important part of a healthy county culture is accountability at all levels. So we're recommending that all staff from the top down receive a 360-degree evaluation so that everyone can contribute to the culture and raise in the values of the new board. This effort is part of the work in changing the culture. Thank you.
Thank you. Next speaker, please.
Hello? Oh, clock's not on. My name is Lyon Paul Hinken. The reason I wanted to speak on this was there, I think her name was Judy, was proud of the 51% response rate. That's like the election I mentioned between Jones and Smith, that one of them got 51%, one of them got 49%. I mean, and you know, most people probably don't care. But 51% is not really a good response rate. And when you factor in the 16% that were judged to be employees that were judged to be disengaged, that's 65%, I think, or 67, that are disengaged. That is really not a really horrible statistic, actually. And I mean, something's really wrong there. And I think it's the whole culture of people, starts at the top, not listening and not taking people seriously just because they speak funny or do weird things or whatever. You know, people take their cues from the top. And it trickles down to management, and I mean, I think that's probably why you got so many angry people in government and elsewhere. Thanks for your attention.
Thank you. Next speaker, please.
You know my name, rock, paper, scissors is my pronoun. So, goodness, I literally feel more stupid listening to that. I feel like it's like the cue red stringers where it's like we're going, look at this, and then you're just sending people in all these different directions. But according to the thing, it said that 37% were fully engaged, not 51. Maybe across the government or whatnot, but in San Diego County, it was 37%. And then you talk about having how many employees, like, that's the thing, you guys' numbers always fluctuate. It's like, we have like 18,000 employees, and then you're like saying that, you know, 6,608 is like half of that. I don't understand. Like, I don't know. Regardless, your employees are not engaged. They're even asking questions. You're asking questions like, oh, can we put in input? And it's like, they don't even feel like they can tell you guys anything. It kind of feels like us here, where it's like, you know, they should be able to engage with their bosses or whoever with them and be like, hey, this is a good idea. And you're just like, no, it's not. It's like us coming here. Are you going to do an engagement survey with the public? Is what I want to know, and see how much engagement you get from the people that you're supposed to work for. Jim, right? Wouldn't that be good? It would be good, right? Because then you guys would know what to do instead of just doing it for the shit of it, right? I mean, let's just do it just because we want to, because it's going to put money in our pockets. Why would we want to know what people actually think, right? Because then they're going to tell us that they're not approving of it. You guys are good. It's good.
Thank you. We'll now hear from the individuals that requested to speak by phone. We'll begin with our first caller.
Me llamo Carla Millán.
Señora, yo soy la intérprete. ¿Su nombre de nuevo?
Yo soy Carla Millán.
Okay, my name is Carla Mía. Adelante.
Gracias. Lo que quería decir es lo que me estoy dando cuenta, que es un circo, ¿verdad?
Okay, what I wanted to tell you and what I'm realizing that this is a circus.
Toda la información la cambian a cuando les dé la gana.
All the information, what you do is you change it whenever you want.
Y mejor cuando ustedes van a ganar más dinero. Nos quitan cada quinto que ganamos.
And that's even better because you make more money and you just take out of us like every quarter that we make.
Disculpe, está hablando, el número con el que está hablando es el número 22. Nomás le pido, por favor, que usted hable sobre el tema porque eso es específicamente sobre el reporte del distrito que se presentó sobre el asesoramiento que se hizo de los trabajadores.
Pero sabes que yo trabajo en el día y no tengo todo el tiempo para estar hablando con ustedes.
I'm sorry.
Ahorita estoy hablando público.
Okay. Esto es, lo que voy a hacer es pedirle que cuando empiece la oportunidad de hablar para la comunidad, la vamos a invitar a que participe, porque ese es el tema 22, así que muchas gracias.
Bueno, no, perdón, no me haga así, ¿eh? Eso es otra vez abuso de su...
So unfortunately, she's not speaking into item 22 because she is not able to, this is not the item that she's speaking to, so we're going to have her speak at public
Mira,
comment.
eso es control, eso es lo que hacen a toda la gente, nos callan y nos siguen haciendo así.
Now hear from the next caller.
Truth, great censorship, Nora. Hey, Andrew, did you fill out this survey? What about you, Helen? Are you happy? Are you engaged? Does it even matter? The San Diego County Employment Engagement Survey was conducted by CPS HR Consulting based in Sacramento. Using their employment test rental rate, they would charge up to $87,000 for a custom test. Is that anywhere near the price of this survey? It should be public information, especially for county employees. Maybe they would have been happier with a bonus in their paycheck instead of receiving an annoying survey most of them deleted as soon as they saw. County employees don't even trust that they won't be retaliated against for their answers because of the politicized environment you supervisors have created. That's why the real math shows that only about 34% of county employees actually took the survey. And of those, 34% said they're ready to leave their job. And 13% said they don't even want to say what they think. That's a lot of unhappy people. Complaints in the survey refer to workers not feeling safe to challenge the way things are done, and that the departmental leadership doesn't value their ideas and input. Contrary to what the survey suggested, just because county employees know that the survey supervisors value the DEI agenda doesn't mean that they like or agree with it. In fact, I know that county employees have felt excluded rather than included in the county's values just because they had medical decisions that you supervisors disagreed with. Just like Nazis who forced or coerced Jews to get medical procedures against their will, you supervisors did the same when you told county employees to get those toxic COVID shots to keep their jobs. Those who refused were either fired or had to quit. And for what? This item admits that county employees don't even feel that there are opportunities to advance and move to different departments. So nobody believes you supervisors care now for this listening session in March. If anything, CPS HR needs to guide you supervisors into understanding the survey results, because you guys don't even listen to the people as it is. Circus indeed. Carla is right, and that's why you censored her, Nora. Misinformation minister, Nora, pardon me.
Thank you, Chairwoman Vargas. That concludes public comment on this item.
Thank you so much. Can you do me a favor? Can you put back that last slide about what the next steps are? Or I don't know if she's able to. Please.
Chairwoman, while that slide's being pulled up, I just want to clarify on the numbers. There were 2 departments that did not participate in the engagement survey, the Sheriff's Department and the Assessor Recorder County Clerk, and that's why the number was just over 6,000 and represented the 51%. So anyone doing the math, I just wanted to explain that. Thank you.
Okay. Thank you. I appreciate the work that's been done on this item. I think the recommendation on the board letter says, just accept receive the San Diego County Employee Engagement Survey results, but I wanted to make sure that we were very clear that there's some action items and next steps that I think are really important. I think we heard from some of, the folks from the county, including our local union, about some recommendations they may have. And so I think making sure that the process is, this is not the end. The survey is not the end of it all. The survey is a part of us really trying to get the tools that we need to figure out how we make sure that our county team feels valued, that they have the resources that they need, have the training. Do you guys want to leave now or you want to wait? And so for me, it's extremely important that we use this as a part of it, a part of the discussion as we're moving forward. And I think there's some good recommendations, and I know that there's some opportunities for us to still grow. But I want to just emphasize to the folks who are working for the county that we take it very seriously and making sure that everybody has what they need to be able to do a positive impact on our community. I really appreciated the people who were able to respond that said that they feel like they can actually make a difference working for the county. So I thought that was great. Again, there's still a lot of work to be done, but I felt it was important to share this information not only to the board members, to the community, to see where we were at as we're moving forward. And this is a baseline, to capture the employee input. And we're going to continue to find ways to solicit additional feedback. And again, there's some key dates that are up there about where we're going and what the next steps are, including additional training opportunities, et cetera. So thank you for everyone that participated. I know sometimes filling out those surveys is like one more thing to do, but we can't move forward and do this work if we don't hear from our team as well. So with that, I'm happy to make a motion to accept the report. We have a motion and a second, and Vice Chair Lawson-Remer.
So first of all, thank you. I have a whole bunch of comments, but before I get to my comments, I actually just have a lot of questions, and I apologize. They're probably really dumb, so I'm very apologetic. I'm just trying to follow. I think I got a little lost. So and I'm really sorry. I followed up to page 6. That was great. That all made sense to me. Okay, but then we get to key drivers categories. I want to make sure I understood how the weight is being categorized. Is that, is the engagement score the dependent variable and the weight the correlation coefficient? I just have a bunch of questions, so I want to go through in an orderly manner.
Sure. So the 6 questions, the engagement questions, are the dependent variables.
Okay. And then, that makes sense. And then the weight is for example, key drivers. Then you did an average of the different questions under each key driver. So for example, diversity inclusion has these 4 questions that are there on page 9. Vision has 4, that's on page 10. So you took an average, and then that average score was what you were using for the key drivers. Is that right?
Yes, but we're happy to share the key driver weights with you so that you can see what we did and what we used. But yes, for sure. What we were looking at were the questions within each question set, and then we were using the weight based on what we saw in terms of the analysis as it related to the dependent variables.
But sorry, I'm just to be clear. So I'm still trying to understand. I have a bunch more. I'm very, very sorry. I feel like I can't believe I'm asking these dumb questions. But the weight is that like a combined correlation coefficient, or what is it? How'd you calculate it? Because the weights are different, right? So you have under key.
They're different based on each question, based on the way in which the group of questions were factored into the analysis. So yeah, each question has a different weight, and we calculated that weight based on the information that we had related to the analysis that we had for those questions as it related to the dependent variables. And I can give you, I'm not the one who did this analysis, so I'm certainly happy to give you more background information in terms of how we calculated these weights, as well as what the weights were. Although I think in the data that you got, you might have actually gotten the weights themselves.
Yeah, I see it all. I have a look. This is amazing. It's super helpful. I have a bunch of comments and sort of thoughts on my forward. I just want to make sure I really understood what I'm looking at. Okay.
Okay.
I think, yeah.
Vice Chair, why don't I suggest that we have the consultant and also the person that did the analysis for her arrange to have a call with you, a Zoom or a meeting in your office to go through the detail.
I don't want to drive everyone crazy. I just felt like I didn't understand. So thank you.
No, and that might inform the next survey, because I think that's where you're also interested in finding out, okay, the next time we do this, how can we improve on that as well as what we're doing in terms of the action plans. So we can certainly take that and do a more in-depth with you at your convenience. If that would be great, because I think this kind of setup assumes that the outcomes that we care most about are these the engagement metrics, which I'm not, maybe. So, but I would actually be
right. No, you're absolutely right that is the way this is set up. But that's why we also gave you and every department the data on all the questions that were asked so that they can choose to identify the areas they want to focus on. They may want to focus on the ones that are key drivers for engagement, or they may want to focus on some of these other questions that are low scoring, but aren't a key driver. They're just low scoring and they're concerned about that question.
Yeah, I mean, obviously this is we all kind of focus on the things that are relevant to us, but I was very concerned that we're getting low scores on it is safe to challenge the way things are done, or I feel encouraged to come up with new and better ways of doing things. I feel like really would like to see a lot more work that we could do to make people feel safe in challenging the way things are done and, coming up with new and better ways of doing things and innovating and all that. So, I think what I definitely did see that, at least 16% of our employees are not feeling engaged, which I think is not great. I know we've gone through the pandemic and it's just been so hard on so many people and it's just been a really difficult time. And, I think, I know our county is made up of a lot of people who really care and show up every day to do their job and are really just passionate about serving our county. But we also have to think long and hard about how do we protect and fight for the well-being of the folks who are doing this work and are serving our community. And so I think this is just really important. I want to make sure that we're getting kind of additional guidance and feedback, certainly from all of our stakeholders and our employee union. And I'm going to be interested in sort of the methodology and how do we do that. But I also think there just didn't seem like there was a lot of listening sessions. So I was just wondering if maybe we could have some additional listening sessions for county workers as we move forward. That seemed like a kind of an actionable next step. And I also was really interested in this idea that came from someone on public comment on the 360-degree evaluations. So those are I think were not necessarily included in action steps, next steps. So I'm curious if it would be feasible to kind of include those two as kind of more listening sessions and the 360 evaluations as next steps, like regardless of my methodology questions.
So that is exactly what we encourage in terms of the action planning with the departments, is that don't just take this information and run with it as a solution, because we don't really know why people feel the way they do about some of these things and what kinds of behaviors and actions or situations that are causing people to feel the way they do. And so we've encouraged, as a part of action planning, that departments think about how they engage with employees, how they have listening sessions, how they have skip level conversations so that they can get to people and hear what people have to say, so that we can be more informed about the kinds of solutions that would make the most sense.
I mean, just to follow that up, though, I would say, sometimes the folks that are sort of least interested in doing a 360 review might be the ones that most need that encouragement. So just kind of a thing to think about of how we can maybe encourage departments that are less interested in doing those introspective deep dives to really lean into this, because I could imagine that the parts of our enterprise that are sort of most resistant to this kind of reflective enterprise and activity are the ones that most need it. And so that's really my question as we move forward of, how can we sort of engage most effectively with our kind of our parts of our enterprise that might be sort of less enthusiastic about this this process.
Yeah. And the fact that the information is available at the department level, there's a lot of variation among the departments in terms of the results of the survey. And that's really where we have an opportunity to identify where some departments need to work on some things very different than what other departments may need to work on. But that one point about it's safe to challenge the way things are done, I highlighted that one because that was kind of across the board. And that's why I think that that's something that countywide we really want to think about. What is it that we may be doing within departments, but even countywide, that we need to improve on?
Yeah, I've also thought about looking at the data from like a desegregating the data to really look at sort of the where, because sometimes I think we pile on the information and we assume it's just in general. So it'd be interesting to see where exactly it's happening. And In terms of the 360s and some of the other evaluation tools, I would like to highly recommend that the Human Resources Department work closely with executive team and try to figure out what are the different opportunities to really be able to do these kinds of assessment, and when maybe make recommendations to what I know 360 is where we actually always go directly to, but having been an executive in my other life and understanding the culture of change, 360s may not get us to where we need to be or the feedback that we need. And so there's a lot of other different tools. So to your point, Crystal, I'm not saying no to 360s. I'm just saying there's a lot of different tools that you can utilize that are cost effective, that could be, get a lot of information from your teams, and then you create plans so that you are actually being held accountable as to if there's any movement in the needle. So what I would like us to do is just really think about it from a broader perspective and provide those tools for management and then also for leadership, and then you know, provide opportunities for a lot of conversations around managing up and what that looks like as well. So I know that all of you are doing a lot of different things, but I think to Vice Chair's point, I think there's room for improvement in a lot of different spaces, but I would like us to see different tools and not just focus on one as we move forward. So.
The one thing I have cautioned the department heads and the group heads is that you really need to focus on the one thing we need to work on first, rather than to try to go after a lot of different things. People's workloads are crazy, both at the working level as well as at the top. And the idea that we would try to tackle a lot of things at one time would probably mean we won't be successful or effective in dealing with any one of them well. And so we really need to focus on what's the most important thing we want to focus on, fix that, and then move on to the next thing, so that we really can demonstrate to the employees that we're really serious about addressing whatever issue it is that they're telling us we need to work on.
I looked at the wrong place. Okay, we have a motion and a second. Please vote.
Chairwoman Vargas, that motion passes unanimously with all supervisors being present and voting aye.
All right. With that, our next item is board committee reports at each meeting. I'm going to ask each one of us to give a brief update, report on progress, or share pertinent information during this time. Is there anything that my colleagues would like to share? No? The one thing I wanted to share just is that this past Friday at Sandak, we were able to celebrate from our youth opportunity passes. We have now 5 million ridership since last year in May, so it's pretty exciting to see that. And ridership has also doubled, and I think that's really exciting, and it's a wonderful opportunity and collaboration that we have with MTS as well. So excited about that. And now that concludes the business before the board meeting today. Oh, well, we still need to do close. Oh, public comments. Okay, but we're going to do adjournments first. So for our adjournments, today's first adjournment is going to be presented by Supervisor Fletcher in memory of Rachel Ann Arrington and Rose Schindler.
Thank you. Today we adjourn our Board of Supervisors meeting in honor and memory of Rose Schindler. We take a moment to remember her life, a Holocaust survivor, lived in San Diego since the 1950s. Rose passed away at the age of 93, leaving behind a tremendous legacy of courage, resilience, and strength. When her son Stephen was in the 8th grade, he was in a play, A Diary of Anne Frank. He mentioned to his teacher that her parents were Holocaust survivors, and the teacher asked if she would be willing to speak, and as Stephen described to the San Diego Union Tribune, my mom spoke, and until 3 weeks ago yesterday, she never stopped talking about the experience. And what a story of bravery it was. Rose was born December 28, 1929 in a small town in Czechoslovakia. Throughout her childhood, anti-Semitism was on the rise, and by 1941, all of the Jewish folks from her region were forced to leave their homes and were sent to a town where they waited trains that they would board in cattle cars to be taken to Auschwitz. Her father's last words to her at Auschwitz were, "Whatever you do, stay alive so you can tell the story of what they're doing to us." And she did. At a critical turning point in her time at Auschwitz, Rose lied and claimed to be older than she was to avoid the lines of younger children that were being sent to the gas chambers first. They would tell me, if they put you in a gas chamber line, look for a moment where no one sees you, get out of line. And that's what I did, she would explain during one of her many presentations. After surviving 5 months in Auschwitz, she and two of her sisters, Helen and Judy, were transferred to a work camp, and they stayed there until the war ended. Both of her parents and 5 of her siblings did not survive the concentration camps. After being liberated, she and her sisters went back to Czechoslovakia, back to their childhood home, where they found it looted. None of their remainings belonging. Thanks to a rescue effort initiated by the Central British Fund for German Jewry, they, along with 700 other young Holocaust survivors, were sent to Bedford, England. It was there that she met her future husband, Max, also a Holocaust survivor. They married in 1950, and a year later they moved to Brooklyn. Rose was an enormously talented seamstress and was the main breadwinner for the family. In 1956, a friend of theirs stationed here in San Diego recommended they move. And within 2 days of being here, Max got a job with the defense contractor. They lived in the Del Cerro community, where they raised their 4 children and where Rose lived for the rest of her life. Max and Rose were married for almost 70 years before he passed away in 2017. Rose Schindler is survived by her 4 children, Roxanne, Benjamin, Stephen, and Jeffrey, 9 grandchildren, and 2 great-grandchildren. We express our deepest condolences to her family and friends. May Rose Schindler's memory be a constant reminder to all of us. We will never forget her story. Today we adjourn today's Board of Supervisors meeting in honor of Rachel Ann Arrington, born on September 7th, 1970 in Tucson, Arizona, but spent much of her childhood here in San Diego, where she graduated from Gompers Preparatory Academy in 1988. She went on to graduate from Jackson State University with a BA in Foreign Language with a focus in Spanish. The County of San Diego Probation Department was fortunate to have Rachel as an outstanding team member for the last 15 years. She will be greatly missed. Many people who spend their work life helping other people use their free time for themselves, but not Rachel. When she wasn't working, she was busy making San Diegans' lives better. She volunteered with many civic and nonprofit organizations, such as the San Diego NAACP chapter, the Black American Political Association of California, and SEIU Local 221. If that was not enough, she was also incredibly active in her church, Logan Temple AME Zion Church. She served as an officer, missionary, food bank coordinator, choir director, and class leader. Rachel especially loved connecting with and helping the youngest and oldest members of the church. No matter what was happening in her life, she always found time to help. Always a hug, a smile, always someone with words of encouragement. And we can't forget her 2 other passions, her dog Stuart Little and the Las Vegas Raiders. Friends report they always knew who would post first when the Raiders won, and if they lost, well, there was always some good reason out of their control that explained their defeat. We extend our deepest sympathies to her mother, Reverend Annie Watson, her sisters, Donna Alexander and Reverend Denise Jackson, and their entire extended family. Rachel Ann Arrington devoted her life to helping her community and was a great friend to many. Her dedication, commitment, and compassion will never be forgotten.
Thank you. Our next adjournment will be presented by Supervisor Jim Desmond in memory of Louis Martinez.
Thank you, Chair. I'd like to close this meeting in adjournment in memory of a longtime Escondido resident, Louis Martinez, one of the most well-known restaurateurs in Escondido. Louis passed away at the age of 87 in January of this year. He was surrounded by his close family members, children, and grandchildren holding his hand while telling stories and listening to jazz music. Louis was a longtime owner of La Tapatia restaurant, whose family founded the popular Mexican eatery, and which is still owned and operated for dozens of years. He was born in Santa Monica and joined the family restaurant business at 6 years old, when his father opened a restaurant in the La Jolla and Bird Rock area called La Rancherita in 1942. Previously, Louis' grandparents opened a restaurant in Escondido on Grand Avenue in 1934 called La Tapatia, which stands there today. Actually had my birthday lunch there last year. Louis ran both restaurants before he sold the one in La Jolla, and he continued to run the family restaurant in Escondido until 1987, when he handed the restaurant off to family members. This allowed him to pursue his love of music. He was a concert promoter and was part of the team that started the concerts after the Padre games when they were held at Jack Murphy Stadium. He actually came back into the restaurant business in 1994 at La Tapatia, and then he successfully sold it in 2004. And throughout his time at the restaurant, he incorporated jazz nights at the restaurant, and they were very popular. During his time, he developed an even stronger relationship with the Escondido community, resulted in him being selected as a Grand Marshal for the 1998 annual Grape Day Parade. We send our condolences to Louis' entire family. He was a beloved community man who enjoyed his blessed life, and he will be missed by the entire Escondido community. In memory of Louis Martinez. Thank you.
Thank you. So the last adjournment will be presented by myself in memory of Raquel Vargas Ojeda. So today I have the honor of adjourning today's meeting in honor of my Nina, my godmother, Raquel Vargas Ojeda. She was born on January 21st, 1930, and she passed on February 10th, 2023. She was born in Nogales, Sonora, and she was so proud to be a teacher. She was a teacher for 48 years. She taught so many students, including me. She was my first grade and fourth grade teacher in elementary school. She was so tough, but only because she believed in her students. I learned all the states and capitals because of her. And you pretty much couldn't go to recess without memorizing all of them and being quizzed. She was my dad's sister, and she adored him. And she spent a lot of her, I spent a lot of my early childhood at her house. She was a wonderful lady who's now in heaven. And when thinking about her and the work that she did for so many students across the community, it reminds me of the power of education and really who she was. And so for me, it is an honor to really be able to honor her legacy today and thank her for everything that she did. She is today survived. She was one of 11 kids of both Casimiro and Carmen Ojeda Vargas, my grandparents, and she is survived by my cousins Sara, Enrique, and Casimiro and their children, and my Nino Lupe, who she was married to for 64 years. There will never be an end to her light as her wisdom was spread with so many and shared with so many and thousands of students across the community. And so in her memory, we adjourn the meeting today. Thank you. With that, we're going to move over to closed session. First, non-agenda public comments, and then closed session. Thank you.
Thank you, Chairwoman Vargas. We have 11 remaining requests to speak on matters not listed on the agenda, 3 in person and 8 requesting to speak by phone. For those that requested to speak by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers. As your name is called, please come forward. You'll have 2 minutes to address the board, and I'll ask you to state your name for the audio record. I'd like to invite forward Pam, Audra, and Consuelo.
Consuelo. May Rose's memory also be to never trust government. We learn from history that we haven't learned from history. To the normies, the statist slaves, are you expecting someone from the system to hold the system accountable for doing exactly what the system was designed to do? Are you sitting back, trusting the plan and waiting for someone to subvert the entire system and save us all? The system was designed this way, and no one is coming to save us. We must act. We must save ourselves. We must be free now. We must step away and create the new. You either want to be free or you want to be controlled. There is no in between. Reminder to some people some people are not put here to evolve. They are put here to remind you what it looks like if you don't.
You, next speaker, please.
You know who I am? What Rose said actually really resonated with me because she said, stay alive so you can tell them what they're doing to us. That's real. Because we come before you guys and you just want to brush us off and be like, you know, it's like we have a gold star and it's like, go over here. We don't need to pay attention to you. But, you know, as I think about it, it's like tyrants under duress play the victim card and they want to claim it's like their professional duty to help us, right? And like everything that they're doing is, you know, for the people. And it's just sad because it's like, I just ask that you abide in the Lord and let him guide you and search your soul. And, you know, as we come before you, it's like, I would like to plan a civic engagement with you guys and the community so that we could sit down together and actually have a conversation. Because here we can. It's like you sit here and you do whatever you want. You're not paying attention to the people, but the reason we come here without being paid, with being abused, and still come to you, it's because we care about humanity. And I wonder if you do and you sit there and you want to just shut us up and do whatever, and it's like, I almost thought this turned around. But it's serious. It's like, I mean, as these Holocaust survivors talk about the things that we're actually going through, Nathan, and saying, stay alive, so that we can tell them what they're doing to us. I couldn't be more important, so I'm going to reach out to all of you.
Thank you. Thank you. Your time is up. Thank you. We're now going to hear from those that requested to speak by phone.
Your time is up. Thanks. Nope. No. Can you please go ahead and ask the next speaker to go?
Thank you. We'll now hear from our first caller.
Good afternoon, Chair Vargas and Supervisors. My name is Becky Rapp. I'm a parent and a public health educator. I would like to share with you some very important news from the Drug Enforcement Agency. They issued a letter stating that delta cannabinoids, including delta 8 and delta 9 THC, synthetically derived from hemp, will not qualify as hemp, but will be viewed as a Schedule I drug. The DEA stated that delta products are not natural. They're chemically synthesized and thus do not qualify as derivatives of hemp. The DEA goes on to say that the product has been tested and proven to have longer lasting effects and is more potent than standard THC. We currently see delta 8 and delta 9 THC products being sold across the county. They're being sold in conventional retail, such as gas stations and convenience stores. Local smoke shops openly advertise these products with flags stuck in the grass of shopping center entrances and colorful signage in their windows. There's a growing concern that underage children can buy these products, as the idea of purchasing any THC product from an unregulated retail facility could be enticing and viewed as an easy way to get high. How will this news be distributed to retail outlets that are currently selling these products? What kind of enforcement can we expect to see in the future? And how soon will these products be removed from the shelves? Thank you.
Thank you. We'll now hear from the next caller.
Good afternoon, Board. My name is Kathleen Lippitt. I advocate for public policies that effectively address the problem for which they were designed. I'd like to share a couple of relevant articles with you. The first is a UT article that asks the question, can the legal cannabis industry be saved? It's important to ask, what 5 years of legalization so far have brought us? Preventing drug abuse was abandoned in favor of industry-preferred harm reduction. Predatory addiction industry strategies reached teens on social media, launching many on drug journeys that would end in opioid and fentanyl overdose. Drug addiction and mental health problems contribute to 64% of today's homeless population. Violent drug cartels south of the border moved to California to grow marijuana and hemp. destroying sensitive habitats, poisoning wildlife, stealing and polluting groundwater, rivers, and streams. Food crops have been replaced with hemp and marijuana. Industry profits were used to lobby and influence political leaders to favor marijuana interests over public health and safety. Increased drug use has led to increased emergency room visits, poisonings, mental health problems, and vehicle and work-related injuries. And the revenues promised to voters are instead being used for grant funding to the industry. To date, over $100 million of taxpayer dollars have been spent on equity and marijuana program development. Another $20 million grant was just announced to remediate the environmental damage caused by marijuana and hemp cultivation. Politicians work to lower taxes on marijuana while the state spends millions of taxpayer dollars to ameliorate the problems that it causes. It's not whether it should be saved, it should not be saved. It is not for anyone's benefit other than.
We'll now hear from the next caller.
Good afternoon, Board of Supervisors, Chair Nora Vargas, Ann Riddle here. I've come to share some information that we in the parent and grandparent community are very excited about. In fact, we concur with the plan to reach out or at least use the name of caregiver when we're doing problem solving for young people, because this is a webinar tonight that is for parents and caregivers. And we all appreciate that understanding that caregiving is given by a lot more people than just parents. It's a series that's being put on by the County Office of Education and Rady's Children's Hospital. They've been concerned about what they've seen in mental health with our children. So tonight's webinar, and it starts at 6, and it's part of a series actually. This is webinar number 2. It's called Vaping, Cannabis Use, and Mental Health. No one has recognized more clearly the problems associated with mental health and its relationship to the marijuana use by young people than our schools and Rady Children's Hospital, who operates a premier children's mental health wing. I would suggest that staff, those listening, consider signing up. You can find it online and watch this wonderful presentation that they've gathered up the experts, the medical experts across the county to speak to us tonight on this important issue. Thank you.
Thank you. We'll now hear from the next caller.
Hey, Carla, this is Truth, the 9th round boxer that counterpunched to end all clinchers. But guess what? A county employee tried to say I already said my non-agenda. Lies for censorship. So item 13, Norris spent over $193,000, including $5,000 to United Way, whose board of directors includes Crystal Irving. Their CEO, Nancy Sasaki, has blogged about white privilege. And $4,000 to drugs and diagnostics for tropical diseases for large-scale manufacturing of hepatitis A tests. Their board of directors includes former Merck, Novartis, and Eli Lilly employees, and they're partnered with the WHO, NIH, and the CDC. And $35,000 went to Grid Alternatives for a solar project at a private residence in Logan Heights. A secret communist lair, perhaps? Item 14, Joel spent over $472,000. Item 15, Paris bad choices were Aaron Burgess with the Leon Williams Commission. Aaron was Nathan's associate. And Eve Benton and Christine Puerto to the Commission on the Status of Women and Girls. Eve's the chair of San Diego Blood Bank, who's received over $80,000 from these supervisors in less than 1 month. And Christine received a certificate from Nathan's wife, Lorena, in 2016. And Nathan's bad choice was Sarisa Korn-Smith to the Advisory Council for Aging and Independent Services. Smith's with the Milken Scholars Program of the Milken Institute, who's talked about blowing up the health system and mRNA shots back in 2019. Lastly, Joel, I noticed your friend Dan Bickford's a real compromiser, much like yourself. And it seems your friend Samson Osborne is pretty disrespectful and not too big on free speech. He actually wants to shut me up. I think that shows how intimidated he is by little old me and my big brain and truth-filled mouth. Well, he stays at home whining on social media like a little baby. Pretty fitting friends, I'd say, Joel. So to end today, Viva Vargas.
Thank you. And Chairwoman Vargas, that concludes the request for non-agenda public communication.
Thank you. With that, we'll proceed to closed session, and this session is adjourned.
Thank you. The board will now recess into closed session to continue consideration of those matters listed under item 23 on today's regular agenda. If there are any reportable actions, it will be reported out during the planning and land use session of this meeting tomorrow, Wednesday, March 1st, 2023.